Now I'm going to do first my hand washing. Make sure I'm doing this more than 15 seconds. And now I'm going to wash my hair. Now I'm going to dry my hair. And now I'm going to don a new gloves. Now, after hand washing, now I'm going to gather my supplies, which is the gloves, my stethoscope, and my pen light. Hi, Mrs. Brooks. My name is Sheena West, and I'm going to be your student nurse today. How are you today?
I'm doing great.
Alright, can I just verify your name and date of birth, please?
My name is Carmina Brooks. My date of birth is November 18, 1988.
Okay, I'm just gonna check. Alright, thank you. So today I'm going to do physical assessment from head to toe, and I'm going to listen, look, and feel, and nothing should be uncomfortable, okay? Alright, I see that your bed is locked, and I'm gonna bring you in comfortable position. Alright, now I'm going to provide you privacy, okay? Alright, so before I went here, Mrs. Brooks, I already checked your chart for your allergies and your cold status and your vital signs, which is your pulse, respiration, your blood pressure, and your oxygen saturation. And I also check your age and your gender. And do you know if you have any pain today?
No, I don't have.
Okay. Do you know if you have any allergies?
I don't have any.
Okay. All right. So now I am going to do her orientation and speech. So for orientation, I'm going to assess her content, her relevant, and her organization of response. And for speech, I am going to assess her volume, her pace, her clarity, and quantity of her speech. So Mrs. Brooks, do you know where you are today?
I'm in the hospital today.
Do you know why?
I'm here to do some test.
Okay. Do you know what day today?
Today is February 1st, 2020.
Okay. And do you have any kids?
I have 2.
Alright, that's good. So now, Mrs. Brooks, I am going to check your general appearance, okay? So for her general appearance, I am going to inspect if she's well groomed or unkempt, and also I'm going to check her posture. Alright, everything looks good. So now I am going to begin in your head, okay?
Alright.
So first, I am going to inspect the symmetry of her head, and then I am going also to check her skull for size, shape, masses, and scars. And also for the hair, I am going to check for evenness of growth, oiliness, and texture. So now I am going to check her face. So for face, I am going to check the symmetry of her face, inspect it. Alright. Mrs. Brooks, can you elevate your eyebrows for me, please? Good. And can you also close your eyes tight? Alright. Can you frown, please? Okay. And can you smile, showing your teeth and your gums? Alright, thank you so much. And also for her face, I will check her eyebrows and eyelashes for hair distribution and alignment. Alright, thank you. Now I am going to check your eyes. So first, I am going to inspect the color of your sclera. Alright. Now, I am also going to check your pupils, which is I'm going to check your size of your pupils, the shape, and the reactivity to light. So if you can just look straight, and I'm going to use my pen light, okay? Alright, and I make sure that your eyes is reacting to the light. So now, I'm going to check for accommodation. So for accommodation, I want you to look past the object. Just look straight and past the object. So I'm going to check for the constriction of the pupil. Alright, everything looks good. Now I am going to check for your convergence. For the convergence, I want you to look on the object and I'm going to move it. Alright, you can just look on the object and I'm going to move it. Alright, everything looks good. Your eyes is following the object. So now I am going to check the nose. So first I am going to inspect the external nose for flaring or discharge. Okay, everything looks good. And now I am going to inspect the nasal cavity using my pen light. Alright, I don't see any redness, swelling, growth, or discharge. Now I am going to check the patency of both nasal cavity. So if you can just hold your one iris and close your mouth and breathe in. And do it on the other side, please. Alright, thank you so much. So now I'm going to check your ears. At first, I'm going to inspect your external ear canal for buildup of cerumen, lesion, or drainage. And to the other side. And while I'm doing this, I am also checking if you're wearing a hearing aid and if you have difficulty hearing. Now I am going to check your mouth, okay? First, I am going to check the skin integrity of your lips. I'm going to check for dryness and color. Alright, looks good. And now I'm going to check your mouth. If you can just open your mouth for me, please. First, I am going to check if there's bleeding, color, edema, or lesion. Now I'm going to check the teeth for tooth loss, for cavities, chipping, and color. Everything looks good. And I see that you're not wearing your denture. You don't have a denture. And also I am going to check your tongue for color. Alright, everything looks good. And now, lastly, I am going to check your hard palate and soft palate for dryness and color. Now I'm going to check your cardiopulmonary inspection, okay? So first, I want you to breathe in and out. I'm just checking for the symmetry. Alright, everything looks good. And I'm also inspecting your trachea. Alright, everything looks good. Now I'm going to listen in your cardiopulmonary. So first I'm going to use my stethoscope. First I am going to listen in your aortic. and I'm going to listen 10 to 20 seconds. And now I'm going to listen on your pulmonic 10 to 20 seconds. And now I'm going to listen on your tricuspid. And now I am going to listen to your apical pulse for 1 minute. Now I am also going to listen to your chest, the sound of your lungs, okay? If you can just breathe in and breathe out for me in each point that I'm changing the stethoscope. Alright, to check your side. You can just breathe in and breathe out. Now I'm going to check the other side. Alright, so now I am also going to listen in your back. Breathe in, breathe out. Alright, you can just I hear everything is good and everything is equal and normal. Now I'm going to feel cardiopulmonary, okay? So I'm going to touch and palpate. So I'm going to check for tenderness and masses. And also the evenness. Breathe in, breathe out. The evenness of breathe in and breathe out. Now I'm also going to check your back. Checking the back for masses and tenderness. Alright. I don't feel any masses and tenderness, both your chest and your back. Now I'm going to check the cardiopulmonary pulses. So first I am going to start in your carotid. Alright, if you can just decide please. Alright, it's good. Now I'm going to check your radial pulse. If you can just answer like that. And I'm going to feel it for 10 to 20 seconds. Alright, the pulse is even. Now I'm going to check your brachial pulse. Alright, your brachial pulse is good. Now I'm going to check your femoral pulse. Just gonna feel. Alright. I'm still feeling it for 10 to 20 seconds. Now I'm going to feel your popliteal pulse. And just raise it. And then lay it flat. Alright, it's good. Now I'm going to feel your dorsalis pedis pulse. Alright, now I'm going to feel your posterior tibial. So your pulses are bilaterally equal and everything is good. So now I'm going to check peripheral perfusion. So first I'm going to check your temperature. You can just spread your hands for me, please. Alright. Now I'm going to check your skin turgor and color. Alright, everything looks good. Now I'm going to check your capillary refill and edema. Alright, everything looks good. And now I'm going to do it the same in your feet. So first I'm going to check the temperature. Skin turgor. Looks good. And now for edema and capillary refill. Okay, everything looks good. Now I'm going to check your abdominal. So first I'm going to inspect it. I'm going to inspect for masses, for scars, and distension. Then next I am going to listen. Using my stethoscope, I am going to listen in your 4 quadrants. For 10 to 15 seconds. Everything is good. So now I am going to palpate, okay? I'm also palpating it gently in 4 quadrants. Going to feel for masses and lumps. And also I'm going to palpate your bladder. Okay, I don't see any problem. Now I'm going to assess the perineal area. So I'm going to inspect the groin and genitalia for discharge and skin integrity. And also I am going to inspect the rectum for skin integrity, discharge, lesions, and protrusions. Now I am going to do skin assessment for color, bruising, integrity, scars, bleeding, ostomies, fistulas, wounds, and integrity of any dressings. And also, I am going to inspect your nails. And also, I'm going to inspect your toenails. toenails and your fingernails. Everything looks good. Now I am going to do a musculoskeletal assessment. If you can just sit on the side of the bed for me, please. So first, I am going to inspect extremities and joints for deformities of your limbs, hands, and feet. And I am also going to inspect your spinal alignment for lateral deviation and abnormal curvature. If you can just, for me please. Alright, it looks good. Now I am going to assess your muscle strength. So first, if you can just shrug your shoulder for me please. Alright, looks good. And now, if you can just move your face towards my hand. Alright, do it on the other side. Good. Now I want you to squeeze my hand so I can test if both of your hands has equal strength. Thank you. Now I'm also going to assess your muscle strength in your feet. If you can just push like you're pushing a pedal. Alright. Now bring your feet towards your nose. Alright. Your strength are totally equal. Now we're going to do range of motion. If you can just stand for me, please. Alright. And now you're going to copy what I'm doing, okay? Now we're going to do your neck, okay? Now we're going to do your shoulders. Alright, now we're going to do your wrist. Alright. Now if you can do a fist for me. And then spread your hands and bring them together. And if you can reach your thumb and your pinky and do it on your other finger. Alright, everything looks good and well coordinated. I'm going to assess your spinal. So first, as far as you can. Alright. Now we're going to do the hip. Then do it on the other side. Now we're going to do your knee. Other side. Now we're going to do your feet, okay? So if you can just hold it like here. And then it's like you're pushing a pedal. And then bring it towards your nose. And then inside and out. And then do it on the other side. Push it like you have a pedal. And then bring it towards your nose, inside and out. And now relax your other feet. And then curl it. And then spread. And then do it on the other side. Curl it. And then spread. And relax. Now I'm going to assess your gait, okay? If you can just walk 5 steps towards me and back. All right, you have a good walk and you maintain your balance and everything looks good. So that ends our physical assessment. So now I'm gonna help you go back to your bed and make you comfortable in your bed. All right. So I'm going to give you your call light. And you let me know if you need anything else, okay? And now I'm going to open your privacy curtain.
Thank you.
Now I am going to remove my gloves. Put it in the trash. And now I'm going to do my hand hygiene. And now I am going to record. And that ends my physical assessment.